My name is Lorrie Stewart, and the vulnerable population I chose are children, and specifically children in the lower socioeconomic status class. I want to start out with a poem, and it's an ethical formation poem from Gibran K. in 2000, The Prophet. Your children are not your children. They are the sons and daughters of life's longing for itself. They come through you, but not from you. And though they are with you, they do not belong to you. Life goes on even in your dreams. You may strive to be like them, but seek not to make them like you. For life goes not backwards nor tarries with yesterday. You are the bows from which your children as living arrows are sent forth. The archer sees the mark upon the path of the infinite, and he bends you with his might, that his arrows may go swift and far. Let your bending in the archer's hand be for gladness, for even as he loves the arrow that flies, he loves also the bow that is stable. I thought this would put us in the mood to think about children and ethics. Why did I choose children? Children are vulnerable, and children from the lower socioeconomic system are even more vulnerable than children in and of themselves. Children are vulnerable because of their cognitive level. They are easy to coerce, they are easy to fool by adults. They are also vulnerable due to their level of dependency on adults for clothing, food, and shelter. The definition of lower SES may surprise you. By the APA, lower SES is not just dependent upon the income of the family, but also the social position of the family, aka social status and class, and also the parents' education level and occupation. Why choose children and children in the lower SES? Being in a lower socioeconomic system and being a child, it's associated with higher levels of behavioral problems as children and mental health problems later in life. Those are sometimes due to the stress of poverty and also other minority problems that occur. They tend to have lower educational attainment, higher morbidity and mortality from infancy into adulthood. For instance, children in lower SES tend to be born at a lower birth weight, which can cause issues. And then even into adulthood, they tend to die at an earlier age from things like hypertension and stroke. The definition by the IRB is that children are usually under 18 years, but it does depend on the state that you live in. Children are considered a vulnerable population and as such are protected not only by the common rule, Regulation 45, but also Subpart D, which has additional protections for children. You may need to know that IRBs may only approve 3 risk categories of children. 1, studies with minimal risk to children. 2, studies with just above greater than minimal risk, but prospect of direct benefit to child. And or 3, studies just above greater than minimal risk, no prospect of direct benefit to the child, but generalizable increased knowledge can be had about the condition or about the illness. IRBs may also ask that you have consent and assent. Consent would be from the parent, and it would need to have all the usual details that you would need for an adult consent for your study. Children then must indicate assent. If the parent doesn't consent or the child doesn't assent, then they should not be in your program. For an assent, the child must indicate that they are willing to participate in your program. This can be a little tricky depending on the child's age, The younger they are, the less information you're going to give them, or it's going to be simpler information. It's still going to be complete, but simpler. The IRB may set the ages that you'll need to get a scent for the children. The IRB may have a template. At any rate, the older the children get, the more information you're going to give them. They have to agree to participate, and if they say no, then do not enroll them in the study. Of course, there are some instances where parental consent may be waived, such as contraception studies. And there are instances where child assent can't be obtained, for instance, where the child is unable to communicate. But as a researcher, you want to use the ethics of respect and make sure that you attempt to get a consent and assent whenever possible. There are ethical issues around using children for research. Children without health insurance, which there are about 5 to 7% in Georgia. Parents who refuse vaccines. Teens with contraception, pregnancy, and sexuality issues tend to come up as ethical issues. Children without health insurance, do you see them? Do you see them on a sliding fee scale? Do you not see them at all? Those are some of the ethical issues you could deal with. And if you do see them, how do you give them their medication if it's expensive and they can't afford it? Parents who refuse vaccines, they may have a cultural clash. They refuse vaccines because of religious issues or other issues. And of course, as a nurse practitioner, I believe in vaccines and that they keep the child from harm. So that can be quite a moral issue. Some offices would then say that they will not see the parent and the child at all, but is that correct either? To deny the child access to medical care? These are all things to consider with parents who refuse different treatments or vaccines. Teens with contraception, pregnancy, and sexuality issues are always in conflict with the politics of the day. For instance, maybe a younger teen is dating an older, just out of teens boyfriend, and that might be considered illegal or a abuse and possibly even a rape issue. So those are all things you have to consider with children. I want to go back just a little bit. So the nurse practitioner who finds herself dealing with ethical issues can use the 4-box method as given by Jensen et al. And the 4-box method is you organize your information by these boxes before you make your decision. Put in the first box your medical indications. In other words, how can the patient benefit by the care that we're giving today? Using the ethics of benefits and non-maleficence. The second box, you look at the patient autonomy and what they want from their visit with you today, and their constitutional right to have those. 3, are there any contextual issues around justice and fairness that are presenting with this case? And 4, what will happen without treatment? How can the DNP get ready and prep for the IRB? Suggestions by researchers are to carefully put together a study binder with all your necessary information so that it's organized and ready if the IRB asks for it. 2, carefully review the information with your advisor before submitting and proceed with caution. It doesn't say in the researcher's documentation, but I would think to allow extra time because it seems like there are always some issues that come up. Note, research that might be waived on adults may not be waived on children, so allow extra time for that. And institutionalized children, such as children in foster care or the juvenile justice system, even children in school settings, may have extra requirements. I want to end with what the children say. There is a article by Lutzenberg et al. That talked to children who had been in research studies and how they felt about it, and what they came up with things that they wanted the researchers to know, such as they wanted a protected website that they could go to that was just for children, that they could look and see details of studies that were being done with children. Then they wanted the ability to put their names in and to volunteer for studies. They stated they did not need rewards, but rewards did indicate appreciation. They also want to know that they have helped, and they want to know results before publication. One child said, we don't usually get those magazines that you publish in anyway. The final thing that really touched my heart, and may touch yours also, is the children understand that the research may not help them individually, but they want to help other children. One child said, I really had a tough time when I first got this disease. If there's any way that my volunteering and participating could help other children, I want to do that. Here are some of my references. If you need more, let me know. Thank you. My name is Lorrie Stewart, and my vulnerable population was children and children in the lower socioeconomic status. Thank you.